At University of Virginia Health System, we're for sharing the latest health information from top minds to keep you and your family healthy. With UVA Health System Radio, here's Melanie Cole.
While concussions are most commonly associated with sports, they can happen in a variety of other settings. My guest today is Dr. Kristen Heinan. She's a pediatric neurologist who specializes in caring for children with concussions. Welcome to the show, Dr. Heinan. So tell us a little bit about concussion. They're most commonly associated with sports, but there are other settings. I mean, kids can bump their head in a variety of ways.
Yes, absolutely. We see a lot of different mechanisms for concussion in the clinic. For some of the older teenagers, car accidents are quite common, cars versus trees or rollovers. For the younger kids, playground accidents, or this winter, a lot of sledding mishaps were causes of concussion that brought people in.
You know, these are things you don't even always really realize and think about, but now that you say that, sledding, playgrounds, kids fall off of the equipment. What's a parent to do? Is there any way to, in sports, we're looking to the helmets, to teams, to coaches to help us with this. What do you do on the playground or the sledding hill?
It's tough. We have this conversation with parents a lot, particularly if they've had a child with one concussion. They're especially sensitive to the risks and are hoping to prevent future injuries. And you can't wrap your kids in bubble wrap. You have to let them go out into the world. But common sense things, if you're sledding on a hill, probably a well-traveled hill, not in the forest with a bunch of trees, on the playground with a good soft surface, and again, parental or teacher supervision. But accidents and things will happen, and that's what we're here for if something does.
So what are some signs that our child has gotten a concussion? If we see them fall off the monkey bars or bump into a table, what are some signs we might notice?
Sure. So a lot of times, sometimes kids are afraid to say that they have gotten hurt practicing gymnastics in their room without permission. So a parent or teachers even might notice that the child seems more fatigued. A lot of times they might be grumpier. Appetite can be decreased. They may not directly complain of a headache, but you can notice changes like not being as active as usual, being more quiet, not wanting to do all the fun things that they usually want to do. And sometimes, obviously, they'll say, my head hurts, it hurts for me to read, I don't want to play the video games or watch the TV. Just parents are really good at picking up when their child just doesn't seem right. And so those are kind of the big key features of concern.
Dr. Heinan, when children are learning to walk, little babies are learning to walk, we worry about them, falling and hitting things. Can little babies get concussions too?
They can. It helps that toddlers are closer to the ground, and usually you hear the thump and they end up with a bruise on the outside that looks terrible, but they're typically okay. They sure can, though. I mean, we've seen young kids who have fallen or been involved in car accidents, and they'll do the same thing. They'll be sleepier, they might be fussier, not wanting to eat as much. Just kind of, they seem out of sorts, just like they're getting sick almost.
If you do suspect that your child has a concussion, should you always take them to the doctor? Do you go to the emergency room? What do you do?
Nobody would ever fault a parent for bringing their child to the doctor or the emergency room if they were concerned. A lot of times what we do is offer reassurance that, yes, this is a concussion, and it's going to be uncomfortable and nerve-wracking for a while, but then the child will be fine. It's difficult to tell the severity of a concussion oftentimes, but certainly you should definitely seek medical attention if there's loss of consciousness involved, if the child is not making a lot of sense when they return, when they wake up. if there's any weakness on one side of the body or both sides, if they're complaining of really excruciating headache, if there's a lot of confusion. Those are some major warning signs. Also, a lot of vomiting. Some is okay, some is pretty common, but we can worry about more severe head injuries if there's a lot of vomiting or if there's any physical abnormalities that are going along with the concussion, like weakness.
And what do you do for a concussion? Is there anything for a parent to do, or you as a physician? What about things like, for the headache or symptom management, Tylenol? Are any of these things okay? Ice? What do we even do?
Yeah, we're still working on that one. Unfortunately, there's no silver bullet for how to make the brain heal faster at this point, aside from rest. It is very okay to treat the headaches. Oftentimes there's associated neck pain, too. If you think about hitting your head, your neck's attached, so they can have head and neck pain. Tylenol is fine. Typically, recommendations are for the first 48 hours or so to give Tylenol rather than ibuprofen or naproxen, which is Aleve, because it has less of a chance of contributing to bleeding in case there is a more significant injury. But after the first couple of days, your pain medication of choice is fine. We caution people to not rely on that so heavily after the first couple of weeks, but initially that's fine. And then the brain really just needs to rest for the first 24, 48 hours, even 3 days. We say treat it like you have the flu. You're not going to feel good. Let them rest. It's very symptom guided. It's very patient specific. So whatever they indicate that they're up to doing, they should be allowed to do, but rest is key for those first couple of days.
Is there any truth to the video game, television, reading, to keep them out of those things for that first day or so to allow your brain not to, work so hard?
That's a great question. We get that question a lot. There's nothing magic about the TV, video games, and reading. It is, as you said, just a cognitive exercise, if you will, that those things tend to require. That is the problem. So if they're feeling well enough to want to email a friend and say, hey, I have a concussion, I'm resting, but I'm doing okay, that's fine. A lot of times the bright lights of the computer screen or the TV screen are really exacerbating, and the kids really don't want to do that anyway. So there's no magic in what you can or cannot do. It's just whatever symptoms tend to be exacerbated, the noise, the light, is what they should avoid. And the reading, it's great if your child wants to be read to. Sometimes that's easier. There's a lot of visual symptoms that go along with concussion, convergence insufficiency, difficulty sort of coordinating the eyes, and reading can sometimes be really annoying. So if they try it for a little bit and it's okay, no problem. If they try it for a little bit and they just feel terrible, then stop.
So in just the last minute, Dr. Heinan, why should families come to UVA Brain Injury and Sports Concussion Clinic for their care?
It's a really great clinic. It's very interdisciplinary. So we have physicians that are there. We have occupational therapy who does a lot of work with the visual symptoms. We have physical therapy. Educational consultants are available. And then we can set people up with neurocognitive testing or neuropsychiatric testing if they are having trouble with school, memory, things like that. So it's a really great, very whole person-oriented, family-oriented, inclusive clinic.
Thank you so much for joining us today. You're listening to UVA Health Systems Radio. For more information, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole. Thanks so much for listening.